Hi, my name is Singh, and this is Women's Health on the Fly. Today we're going to talk about heavy menstrual bleeding. Did you know heavy periods are one of the most common reasons a woman presents to a gynecologist's office? And yet we don't talk about this very common public health issue. I want to make sure we raise awareness and get more information to one of the most common reasons we see a huge impact on women's quality of life. And there are many options for treatment that are out there, and hopefully we can provide some of that information at the end of this segment. But before I go on, I'd like to introduce you to one of my colleagues, Dr. Sue Aubin, a gynecologist in Ottawa, to give her thoughts on what her patients experience when they present with heavy menstrual bleeding.
Hi, I'm Sue Aubin. I'm an obstetrician gynecologist at the Ottawa Hospital here in Ottawa. Women come complaining of very heavy menstrual bleeding all the time. It causes them to miss work, they're exhausted, they're having trouble keeping up with their family and friends, and they really want some answers. There are lots of options. There's medication, there's surgery, there's devices. There's a tremendous number of things that they can do. There's more options now than ever before. A lot of them are not. They're quite surprised whenever I start explaining that there are hormonal things, there are non-hormonal options, and then there are different types of surgery. Their mothers had hysterectomy, but now we have a lot of different options.
So my name is Véronique or Dr. Moreau. I work as a gynecologist at the Menstrual Hospital in Ottawa. So it all depends, I think, on the age that we see the patients. I do, because maybe I'm younger, but I do see some younger women that come in sporting activities and have heavy menstrual bleeding, which is impacting sports. So especially, in aquatic, synchronized swimming, skating and everything. So, and then I can see the other range of older women or working women who can impact quite significantly in their profession. Some women present not knowing anything, and some others come in and they want, all they've heard of is the big operation or the hysterectomy. So I think we have a great role in educating these women, because there is such a wide range of treatment these days, and I think that's where we come in. We have such a wide range of options these days. Some people would like no treatment, but they can be educated on simple treatments such as progesterone, or like some medical treatment, pills and injections, and we also have some surgical options. So I think there's a good option for every woman out there that is suffering.
So, as you've heard, heavy menstrual bleeding is a real issue that my colleagues see all the time. And here are some key tips to summarize. Number one, we need a diagnosis. If the heavy menstrual bleeding is affecting your quality of life, then ask for help. Doing blood work to see if there's anemia, which is a low blood count or a low iron count, is also important. And treating iron deficiency is very, very important as well. Next, if there are conditions that need to be treated and been diagnosed with an ultrasound or physical examination, then we need to target those treatments. And finally, there are a lot more options today than ever before. There are medical options that are hormonal or non-hormonal, and there are surgical options which can be as aggressive as a hysterectomy, but also minimally invasive in terms of uterine-sparing procedures. The bottom line is there's help out there. Let's talk about these things and let's make it happen for the women who need it most. This is Women's Health on the Fly with Singh. Thanks.